Hello, my name is Andrew Burgee, and I am the Hazardous Materials Training Coordinator for the NYU School of Global Public Health Hazardous Waste Worker Training Grant for our grantor NIEHS. Welcome to our COVID-19 Exposure Recognition module. This module focuses on the use of respiratory personal protective equipment such as N95 half-face respirators and source control face covering use. COVID-19 is thought to spread mainly through close contact from person to person, including between people who are physically near each other within 6 feet usually. People who are infected but do not show symptoms can also spread the virus to others. Cases of reinfection with COVID-19 have been reported but are rare. We are still learning about how the virus spreads and the severity of the illness that it causes. People who are physically near or within 6 feet of a person that has COVID or have direct contact with that person are at greatest risk of infection. When people with COVID-19 cough, sneeze, sing, talk, or breathe, they produce respiratory droplets with the virus. These droplets can range in size from large droplets, some of which are visible, to smaller droplets. Small droplets can also form particulates when they dry very quickly in the airstream. Infections occur mainly through exposure to respiratory droplets when a person is in close contact with a person that has COVID-19. Respiratory droplets cause infection when they are inhaled or deposited on mucous membranes such as those that line the inside of the mouth and nose. As the respiratory droplets travel further from the person with the COVID-19, the concentration of these droplets decreases and infection decreases. Large droplets fall out of the air due to gravity. Smaller droplets and particulates can spread apart in the air. Some infections can be spread by exposure to virus in small droplets and particulates that can linger in the air for minutes to hours. These airborne virus transmissions may be able to infect people who are further than 6 feet away from the person who is infected or after that person has left the space. This can be true when the enclosed spaces have inadequate ventilation and infected people breathe heavily while singing or exercising. Respiratory protection can be provided with a respirator or a mask. Respiratory protection must be approved by NIOSH and OSHA to be labeled a respirator. The key difference between respirators and masks, if surgical or man-made, is that respirators protect the wearer from external contamination when properly worn. Surgical and homemade masks protect the others from the wearer's exhaled contamination. These provide source protection and are not respirators. Here are some examples of masks worn as source protection out in the field. Respiratory PPE must be worn when a social distance beyond 6 feet cannot be maintained to protect against droplets potentially contaminated with the virus. When both parties wear face coverings as a source protection, the risk of spreading the virus is greatly reduced. Surgical and homemade masks protect others from the wearer's exhaled contamination. This illustration demonstrates how source protection works in greater detail. The mask functions as a barrier which keeps potential virus droplets from spreading beyond the wearer's breathing zone. For face coverings to work properly, they must be worn above the nose and below the chin and fit snugly to the face. When removing the mask, always wash or sanitize your hands before and after removing one's mask. Avoid touching the outside of the mask if possible when disposing of the mask into the garbage. When removing your mask, always wash or sanitize your hands for 20 seconds before and after removing one's mask. If the cloth face covering is reusable, make sure to hand or machine wash in warm water with detergent. Machine or air dry after washing before reuse. Since droplets and aerosols are particulates, a particulate respirator is necessary for proper respiratory protection. The letter of the respirator addresses the appropriateness of the equipment to the filter types and the particulates that may contain oil. The 3 types of filtering facepiece respirators are non-resistant to oil, oil-resistant, and oil-proof. The numerical component IDs the efficiency needed to block out the hazard in question. The target size is 10 microns. The efficiency can be 95, 99, or 100% efficiency. The ones commonly used by healthcare workers are N95 respirators, which are sufficient to work in atmospheres and areas where the concentration is known and controllable. Here's an example of ones commonly used by healthcare workers. N95 respirators are sufficient to work in areas where the contamination is known and controllable. Here's another type of N95 respirator worn by healthcare workers. When wearing an N95 respirator, recognize medical signs, symptoms, and conditions that may limit or prevent you from wearing a respirator. Some examples are as follows: respiratory ailments, anemia, diabetes, epilepsy, and cardiovascular impairment. Some others are facial hair, comfort, vision, claustrophobia, and a punctured eardrum. Regarding respirators, make sure to keep track of the requirements for federal OSHA or your state OSHA's respiratory protection standards and any CDC updates. This is a mini quiz. Please answer the following 3 questions. Droplets which carry the virus containing COVID-19 are mainly transmittable within which distance? 12 feet, 9 feet, or 6 feet? Which particulate respirator class protects against oil particulates? N, R, or P? Respirators offer the same protection as face coverings. True, they both protect against an external source. False, respirators offer external protection, face covers offer source protection. Make sure to wear a face covering or respirator within 6 feet of another person. Make sure the face covering or respirator is above your nose and below your chin and snug fitting. Wash your hands before and after putting on or taking off your face covering or respirator. Make sure to clean and maintain your reusable face covering. When wearing an N95 respirator, recognize medical signs, symptoms, and conditions that may limit or prevent you from using a respirator. That concludes module number 4. Be safe and thank you for your time.